Welcome viewers. In this video, I am going to explain about bones of limbs with their respective girdles, along with their important parts. The bone names have been outlined with orange text and their part in blue text. Starting with bones of right hand, distally to proximally, you see the phalangean bones. Except for the thumb, each finger has three bones called the distal, middle and proximal phalange, distally to proximally respectively. The thumb has two phalangean bones, that is distal and proximal. There are 5 metacarpal bones, as you are seeing, which radiate distally from the wrist. Proximally to the metacarpals are the carpal bones, arranged in 2 irregular rows. The proximal row, as you are seeing, from lateral to medial, contain scaphoid, lunate, triquetral, and pisiform bones. And the distal row, from lateral to medial, has trapezium, trapezoid, capitate, and hamate. Besides this, you are also able to see the hook of hamate and the tubercle of scaphoid. The styloid process of the radius and ulna are also visible proximal to the wrist bones. Now you can visualize the radius and ulna. The superior surface of the head of the radius articulates with the capitulum. Medially, head of radius articulates with radial notch of ulna. Ulna is the main bone responsible for forming elbow joint with humerus. In this anterior view of elbow joint, you can appreciate the following bones and their respective parts: the humerus along with its medial and lateral epicondyle, coronoid and radial fossa, trochlea, capitulum, and finally the medial and lateral supracondylar ridge. Laterally, the radius with its head, neck, and radial tuberosity. Medially, the ulna with its coronoid process, radial notch, and tuberosity. Moving superiorly, you can see the deltoid tubercle on the lateral side of humerus. The shoulder joint is now seen, which is a ball and socket type of joint formed by the articulation between glenoid cavity of scapula and head of the humerus. So it is also called glenohumeral joint. The upper end of humerus is seen with the following parts, that is the head, greater tubercle, lesser tubercle, and the intertubercular sulcus. Anterior view of bony landmarks of shoulder girdle include the bones clavicle and scapula. The clavicle in this view has 3 parts medially to laterally, that is sternal end, shaft, and acromial end. The scapula in this view shows coracoid process, acromion process, glenoid process, and supraglenoid tubercle. Please observe the radial groove on the midpoint of lateral surface of humerus. Now you see the posterior-superior view of the shoulder region. The superior border of the scapula is visible, which contains coronoid process, supraspinatus notch, supraspinous fossa, acromion process, acromion angle, and spine of scapula. Below this is the infraspinous fossa. Now you see the posterior view of scapula with its 3 borders: lateral border, superior border, and medial border. Coming back to elbow joint, posterior view, where the olecranon process of ulna is present, nearby the olecranon fossa of the humerus. Medially, the ulnar groove of humerus is also seen. Now, the forearm bones, ulna and radius, are seen articulating proximally with humerus, and the distal ends articulate with carpal bones. Radius and ulna articulate with each other at proximal and distal radio-ulnar joints. Talking about bones of lower limb, that include pelvic girdle, otherwise also called hip bones, and the lower limb proper. The hip joint is a synovial ball and socket type of joint, articulating between the hemispherical head of femur and cup-shaped acetabulum of hip bone. Articular surface are covered with hyaline cartilage. Bony pelvis includes three bones: ilium, ischium, and pubis. In this view, you are able to see the head and neck of femur. The pubis is seen along with its part, superior and inferior ramus, pubic tubercle, and obturator foramen. Moving medially, the parts forming pelvic brim are seen, that is, pectineal line, iliopubic eminence, and arcuate line. The ilium is seen with its medial surface, including ala, body of ilium, and articular surface of sacrum and iliac tuberosity. The iliac crest with its anterior and posterior superior iliac spine is seen. Below the anterior superior iliac spine, the anterior inferior iliac spine can be seen. Moving inferiorly down, the femur bone is visible with its shaft. Moving further down to the knee joint, which is hinge type of synovial joint responsible for weight bearing and movement. In this view, you can see the medial epicondyle of femur, medial condyle of tibia and patella, along with tibial tuberosity on the anterior surface for ligamentum patella attachment. In this view, you can see the lateral epicondyle of femur, lateral condyle of tibia, and upper end of fibula with its apex or styloid process, head and neck. The medial side of head of fibula has a facet for articulation with inferior surface of lateral condyle of tibia. The proximal end of tibia is seen, though the intercondylar area for meniscus and ligaments is hidden by the femur. Moving further down, below the tibia and fibula, you can see the lateral malleolus of fibula along with bones of the foot, which include tarsal bones, metatarsal bones, and phalanges. The proximal row of tarsal bones, except calcaneum, can be seen including the talus and navicular. The head of talus articulates with navicular. The body has superior articular facet for tibia, medial facet for medial malleolus, lateral facet for lateral malleolus. The distal row includes cuboid and the three cuneiforms, lateral, medial, and intermediate, as seen here. Navicular bone is present between the head of talus and distal row of three cuneiform bones. It has a tuberosity for attachment of tibialis posterior. The cuboid bone's proximal end articulates with calcaneum, medially with navicular and with cuneiform. Its lateral surface has a tuberosity. The groove for fibularis longus tendon is present on the underside of the cuboid bone. All metatarsals are in the same plane, each having base, body, and head distally. Coming to phalanges, the big toe has two phalanges, that is, proximal and distal phalanges. Here you are seeing the first 5 distal phalanx followed by the 5 proximal phalanx. Now you see the 4 middle phalanx present in all the phalanges except the great toe. The distal end of tibia is now visible with its medial malleolus, which has a groove for tibialis posterior tendon. Now let's discuss something about arches of foot. The longitudinal arch medial view is shown here. Medially, from anterior to posterior, we have head of metatarsals on the ground anteriorly to calcaneum tuberosity posteriorly. Laterally, lower longitudinal arch is present, having apex at the anterior part of calcaneum. Transverse arch present at the distal row of tarsal bones. Cuboid close to the ground is present laterally, and cuneiform to the ground is present medially. Because of the arches of the foot, dorsiflexion, plantar flexion, inversion, eversion movements occurs. Now at the lower end of foot, 2 P-shaped bones called sesamoid bones are located in the ball of foot beneath the big toe joint. They act as pulley for tendons and thus help to move big toe normally. The tuberosity of navicular and cuboid are visible now. Now you see the inferior surface of calcaneum. Calcaneum forms the heel of foot. It transfers weight to the ground and has the following parts: the sustentacular talus or talar shelf, seen as a projection on medial side. The sustentacular talus has a groove for tendon of flexor hallucis longus on its under surface, and calcaneum tuberosity is seen with its medial, lateral and posterior processes. The lateral view of the foot now shows the calcaneum bone with its body and fibular trochlea. The calcaneum can be seen articulating with cuboid anteriorly. The distal end of fibula is visible here as lateral malleolus, which has a medial articular facet for talus. Now you see the shaft of tibia having an oblique line, also called as soleal line, on upper 1/3 of posterior surface. Going back to the posterior view of knee joint, between the lateral and medial condyle of femur, there is intercondylar fossa for the passage of cruciate ligaments. The anterior cruciate ligament passes from anterior intercondylar area of tibia up to lateral femoral condyle. It prevents forward sliding of tibia on femur. Posterior cruciate ligament passes from posterior intercondylar area of tibia up to medial femoral condyle, preventing backward sliding of tibia on femur. The medial and lateral supracondyle line of the femur can be seen superior to the knee joint. Upwards on the posterior surface of shaft of femur is the linea aspera. At the proximal end of posterior surface of femur, you can see the head having fovea, neck, greater trochanter, lesser trochanter, intertrochanteric crest and quadrate tubercle. At the posterior surface of hip bone, here you see the ischium having body of ischium, lesser sciatic notch, ischial tuberosity, ischial spine, ischial ramus with inferior ramus of pubis and ischiopubic ramus. Between the posterior inferior iliac spine, to ischial spine, there is greater sciatic notch. Superior to the posterior inferior iliac spine is posterior superior iliac spine. So viewers, with this we come to the end of description of the bones of the lower limb and upper limb along with some part of their girdles. Hope this video would have added something to your knowledge about the anatomy of bones of upper and lower limb. Please do like, share and subscribe to my channel so that I am encouraged to post more of such videos.